Welcome. In the next three episodes, we're going to take a detour and take some time to discuss some of the basics about blood sugar. And my hope is that these episodes will help create a foundation for understanding for some other subjects that we cover here. And so, for many of you listeners, these next couple of episodes will be dry and far too like a college lecture, and even too basic for some of you. But if you are a person who finds themselves not quite understanding what we're always talking about here with blood sugar and wants to understand, then the next three episodes are for you. So, what follows in today, the first of a series of probably three episodes on blood sugar basics, we're going to be talking today about why to care about blood sugar in the first place. In the next episode, we'll talk about carbohydrate metabolism from fork to your cell. And in the next one, it'll all be all about insulin because we talk a lot about the role of insulin resistance, and its role in metabolic health. So we'll cover that, I think, in the third episode. So in this episode today, what I'd like to share is why we care so much about blood sugar and why I think you should care about it. So first, I'll touch on some statistics, always dry, but sometimes very helpful. And then we'll talk about how dysregulated blood sugar impacts other aspects of health. So let's start with the numbers. I don't always like statistics. I find they're dry. I thought about talking about this on the first podcast, but I thought, oh, it's too boring. But I really do think it's important to know this for a few reasons. So the statistics are just on type 2 diabetes. Nearly 34 million Americans are living with type 2 diabetes. That is 11.6% of the US population. And of those people, about 25% of them are undiagnosed. So they don't know they have type 2 diabetes. And you might think that that's crazy, but I can tell you the number of people who I've actually said, why don't you go to the doctor and get some labs done? And they're like, oh, you have diabetes. They didn't even know there was a problem yet. So 11.6% of the US population, adult population, has type 2 diabetes. And now for prediabetes, which sounds benign, but as we'll learn, prediabetes isn't really pre anything. So 97 million adults in the United States have prediabetes. That's 38% of adults. And I think these statistics, honestly, are a couple years old. And about, wait for it, 80% of them don't know that they have prediabetes. So 38%, so almost 40% of US adults with prediabetes, and most of them don't know it. What's interesting about that is if you break it down to people who are over 65 years old, 48.8% of them have prediabetes. So that's about half. About half of people over 65 have prediabetes. So let's add those two groups together, just in case you're not following the math. If we take the 38% of US adults with prediabetes and add it to the 11% who have type 2 diabetes, that equals 38 plus 11, 49. 49%, which is pretty close to 50%, 49% have either type 2 or prediabetes. That means around half of US adults have a diagnosable blood sugar condition. Half. And here's something else to chew on. As you will learn during this series, you can have metabolic dysfunction, some kind of blood sugar issues, and your superficial blood sugar labs, like your hemoglobin A1C or fasting blood sugar, can still look normal. Your labs that you get done routinely every year, hopefully at the doctor's office, can look just fine, and you've got some kind of metabolic storm brewing under the hood. But I know this sounds a little like fear-mongering, but you might know by now that I don't believe in fear-mongering. That's not what I engage in. But I do believe in learning how our bodies work and getting good data so we can make better decisions. And what this I hope tells you, is that there's at least a 50-50 chance you've got blood sugar issues. I think it's more likely a 70% chance that you, the listener, have blood sugar issues that you should pay attention to. That's it. It's just information about the likelihood of blood sugar being at the root cause of some of your health issues. So let's back up and define a few important things, starting about how we diagnose type 2 and prediabetes. So the two main lab tests that you will get that we use to diagnose these things are hemoglobin A1C and fasting blood glucose. So fasting blood glucose is exactly what it sounds like. It's what is your blood glucose level in the morning after fasting all night long. That's it. It's a snapshot. But the other one is called hemoglobin A1C, or A1C for short. Unlike the snapshot that the fasting blood glucose gives you, the A1C gives you an average of your blood sugar over a 3-ish month period of time. And it's an indirect measurement because it measures the number of sugars that are stuck to red blood cells. So it will, it can be a little off depending on how long your red blood cells live, and that can vary person to person. But it's useful all the same. So this is how we use them for diagnosis. For type 2 diabetes, it tends to be diagnosed when your hemoglobin A1C is over 6.5, or you have two separate labs where your fasting blood glucose is over 126, or 7 millimole per deciliter, 7 millimole per liter. Now, prediabetes is diagnosed when your A1C is somewhere between 5.7 and 6.4, and that's actually a pretty big range. Or your fasting blood glucose is anywhere between 100 and 125 mg per deciliter, or in any other country besides the US, 5.6 and 6.9 millimolar. So while these labs certainly don't show the whole picture, remember, meaning that it doesn't mean you shouldn't have them done. And what I mean by they don't show the whole picture, remember that you can have some blood sugar issues brewing, but it doesn't show up yet on those labs. But that just means they're not very sensitive. So you should definitely have these done every year at the doctor's office. And don't wait until you're 40 to do them, because as I mentioned, these problems can be brewing for months or even years. So at least you want to catch it when these pop up. And, I know that type 2 diabetes used to be called adult onset diabetes, but school children are getting this. It's happening so much earlier. So there really isn't a time that's too early to start monitoring these labs. And here's something that might really interest you, something surprising. Even very slim people can have prediabetes. Blood sugar issues are not just in people who are overweight. In fact, I often tell this story. A colleague of mine who is a nutrition professional started using a continuous glucose monitor a few years ago to see what it was all about. And much to her surprise, she found that she had prediabetes. It wasn't something that a doctor would have tested her on, because she is and was objectively slim and eats a fairly healthy diet. But like my friend, some people of a certain nationality, certain backgrounds are particularly susceptible to this. In fact, people of South Asian descent do fall into this category. And even at a lower weight and a lower BMI, they have a much higher rate of type 2 diabetes and prediabetes. So don't just think you get a pass because you're slim. And the cause of type 2 diabetes and prediabetes, that differs between people. We typically think of somebody who the stereotype is someone who overeats sugar, drinks a lot of sweetened beverages, doesn't exercise. And sure, this is one way to get diabetes, but some people can develop these blood sugar issues. Some people are just prone to them. Some people develop them as a result of poor sleep. That's a way you can get blood sugar issues, or high stress. Some people are taking a medication which causes high blood sugar. And some people just aren't producing as much insulin for whatever reason. Some people are genetically prone to having insulin resistance, particularly women with polycystic ovarian syndrome. And so, it's a very heterogeneous world out there when it comes to blood sugar. And it's why the solution for one person with diabetes or prediabetes is not always the same as it is for another. It really helps to know what the cause is, to know what the solution is. For example, and I've probably given this example before, if high stress and poor sleep, like sleep apnea, is causing severe insulin resistance and high blood sugar in a person, I've seen that they can do all the cardio and fasting they want, and it's not necessarily going to solve their blood sugar problem until they can improve their sleep and lower their stress and cortisol levels. And that's honestly why I focus so much on using continuous glucose monitors with my clients and on this podcast, because I find the combination of having my clients use them and meeting up over their data on a weekly basis for a couple weeks to interpret it and create new strategies. It really helps us assess the root causes, at least enough to guide us in the most effective strategies. So in the start of this episode, I mentioned that dysregulated blood sugar impacts many other parts of our health. It's not just about that we want to avoid diabetes, but frankly, that's a good enough reason when you look at the statistics. That's why I wanted you to know the statistics, that you've got a 1 in 2 chance, really. So first of all, I want you to point out that I use the term dysregulated blood sugar rather than high blood sugar, and that it's kind of a nod to to the fact that often you can have some blood sugar issues, but it doesn't show up as high fasting blood glucose or elevated A1C. And so some people have normal blood sugar, even on a continuous glucose monitor, but their insulin is high. And we'll talk more about insulin in a couple of more episodes. And some people have very erratic blood sugar going, with a lot of variability, but the average is fine. Some people get very reactive hypoglycemia, even a subclinical hypoglycemia that causes them problems. But what they all have in common is they have a very non-ideal blood sugar regulation. So I'm just going to give you a very non-exhaustive list of all the other areas where dysregulated blood sugar can be problematic. If you have dysregulated blood sugar, insulin resistance, or prediabetes, it contributes to, this is the big one, an increased risk in cardiovascular disease. And this is huge. People are always worried about cancer or whatever kind of diseases, but cardiovascular disease, early cardiovascular disease, is still it's the biggest killer. It's the biggest one. And that includes, I want to point out that includes erectile dysfunction, because for many, I want you to keep in mind that erectile dysfunction for many is a vascular issue. So that's nestled under cardiovascular disease, and blood sugar dysregulation contributes to that. It contributes to hormonal dysregulation, and not just with PCOS. It contributes to higher levels of inflammation, which means more pain, autoimmune disease, and brain fog. And speaking of brain fog, it leads to more problems with mental health and neurological function. It contributes to weight gain, especially belly fat, that visceral adipose tissue. Blood sugar dysregulation does cause non-alcoholic fatty liver disease, which is a huge cause of liver disease these days. And it contributes to low energy. So all that to say, if you look at those disease statistics of diabetes and prediabetes, half of us have diagnosable blood sugar issues. And then if you add to that all the things that are brewing under the surface but not showing up on those lab tests, that number is a lot higher than just half. I was giving it a number of maybe 70%. I think that's reasonable. And given that and the other symptoms that I was presenting about it impacting cardiovascular disease, liver, hormones, energy, mental health, I would argue that it would benefit nearly all of us taking a little time to evaluate our blood sugar and overall metabolic health and take a few steps to improve that. And I would argue that while improving blood sugar might not fix everything, it is going to be a very important component of your health and the health for every one of us. So, and I'm hoping to make that a little more accessible. So apologies if this episode is a little dry and lecture-like. I wanted to keep it short and to the point to just cover some of these issues, but I really wanted to create a framework and context for what's to come, or even what's already come in earlier episodes. But please stay tuned for the next couple episodes where we will get back to basics to understand carbohydrate metabolism from your fork to your cells, and how blood sugar works, and the nuances of how insulin works and insulin resistance. Thanks for listening.